Hi everyone, welcome back to my channel. My name is Ms. Vane. I go by Elaine. I am a nurse practitioner, and today's video I want to talk about everything about nurse practitioners. So I want to answer some questions that you guys have left in my channel and also in my Instagram about this profession. So it's a way for me to kind of give you guys an insight on what I do and also inspire you guys to advance your careers into being nurse practitioners if you're a nurse. So yeah, so let's get started. First of all, what is a nurse practitioner? So nurse practitioners are licensed, pretty autonomous clinicians that works in different specialties, and you need an advanced degree as a nurse. Nurse practitioners provide care in acute care setting, primary care settings, and even in specialty settings. And with their advanced training, they're able to diagnose illnesses, they can treat it, they can provide evidence-based, health education for their patients, they can prescribe medications, they can pretty much do everything. So the next question would be, what do nurse practitioners do? So nurse practitioners actually have different responsibilities based on their specialty. If you guys also want to see, I have a lot of day in the life videos that you guys can check out. There's one for primary care, there's one for urgent care, and there's one for pulmonary nurse practitioners. So I love doing day in the life just to give everyone a glimpse of what I do, just to kind of give you an idea if it's something that you'd like to pursue in the future. And also I think it's based on the state that they live in. Here in America, we have prescriptive privileges across all 50 states of United States, meaning that we can actually prescribe medications. However, our scope of practice is very different according to state. Right now in California, we are on a what we call restricted practice, which just means that we require direct supervision or team management of at least one element in our nurse practitioner practice. Whereas there are different states where nurse practitioners have a full practice, like in Oregon, Washington, meaning that they can diagnose, they can pretty much do everything on their own. There are ones that are reduced practice, so that's like in New York or Utah, where you still need to work or collaborate with another like healthcare provider, like a physician. How do you become a nurse practitioner? So in order to become a nurse practitioner, you'd have to be a registered nurse or a nurse first with a bachelor's degree. So typically the timeline for being a nurse practitioner, depending of course if you want to work as a bedside nurse first or if you want to go straight into a nurse practitioner school. So it depends. Like for me, I did 2 years of prerequisites for nursing, 3 years of nursing, and then I graduated with my bachelor's degree, worked as a nurse for 6 years, and then I went to NP school for 2 years or 2.5 years, and then now. So that's a total of, I don't know, 4, 5, 6, 7 years. There are actually direct entry programs now where you can go straight to to have your master's right away, which is kind of crazy in my opinion. But in my case, I got my BSN first, I worked as a bedside nurse, and then I ended up going to NP school. And even NP schools actually vary. So in my school, our program is 2.5 months. So there are some that's only a year. There are some that's 18 months. So that's one thing that I kind of want to talk more about, is the differences in the curriculum of NP schools and how I want to advocate for more standardization. can't even say that word, of NP schools, just because I feel like there should be a standardized curriculum for all NPs across the whole country, just because it's so different, the training from one state to the other, and how hard it is for some schools to get preceptors. And yeah, so next question is NP specialty. So there's different specialties for nurse practitioners. In this, the main two big ones definitely is an acute care and a family nurse practitioner, an acute care nurse practitioner and a family nurse practitioner. And how I see it really is like, depending on the setting where you want to work at or the type of conditions you want to treat. In acute care, nurse practitioner, you're pretty much working in the hospital and treating acute conditions. So you're going to be working either as a hospitalist or intensivist or in the emergency. So those are the ones. And then if you're a family nurse practitioner, there's more subspecialties under family nurse practitioner. So you're treating patients from all walks of life, different ages, and the setting where you're most likely going to be working at is definitely the clinic setting. So yeah, so that's the main big difference. And in family nurse practitioner, you can even go into like psychiatric, you know, route, psychiatric nurse practitioner. You can even be pediatric nurse practitioner or a neonatal nurse practitioner. There's so many subspecialties. And for me, just to answer most commonly asked question, why I became a family nurse practitioner, and that's the reason. And the reason why is because I easily get bored and I can't be stuck in one place, and I feel like there's more versatility being a family nurse practitioner than any. So according to AANP, that 55% of NPs are actually family nurse practitioners, and acute care NPs compromises like 7.7%. Adult gerontology nurse practitioners is 20.8%, and then pediatric and neonatal is like 8%. Psychiatric mental health nurse practitioners are 4.2%, and then women's health nurse practitioners is like 5.4%. So as you guys can see, that a big, like almost half of the nurse practitioners in the United States are family nurse practitioners. Next question. How much do nurse practitioners make? So that's one big question that I always get, because everyone thinks that just because I'm a nurse practitioner, I make it rain. We make good money, and your pay greatly depends on your experience and also where you work at. So one more thing that's good with being a nurse practitioner is you're able to actually negotiate your offers. So nothing else. So when I was applying for a job and I got the urgent care job, they were offering me like really low offer considering how much urgent care nurse practitioners make in our area and also my experience. So I had to counter that offer and actually negotiate that I need this much. This is the ongoing rate for nurse practitioners in the area. Also, if you're not able to give me this rate, can I get this? You know what I mean? So there's a lot of negotiation with your salary, and I can talk more about that in a separate video because I feel like I negotiate a lot about my salary. Like, long story short, know your worth, research how much nurse practitioners make in your area and go from there. Don't ever make less than how you were making as a registered nurse. That's my main advice. I mean, even if you need experience, I think that you need to Be picky. Yeah, be picky. Another question is, what type of hours do NPs work? And this will really depend on where you work at. Is that it varies. So if you work in the clinic, you'll most likely work the typical 9-to-5 job. But if you work in the hospital, then it will also be different. Right now I'm doing 10-hour shifts Monday to Thursday, and I work in a specialty clinic. Kind of want to briefly talk about also the licenses and certifications that you need to get in order to practice as a nurse practitioner. So when you graduate your master's, when you graduate in NP school, you earn your master's degree in nursing. Back then, before, you don't need any certification or anything in order to work as a nurse practitioner. I remember my professor saying that as soon as she got out of school, she was able to practice as a nurse practitioner. But nowadays, every working places, they require you to have a certification. So there's a certification that you have to get either from ANCC or AANP. I personally got mine from AANP because AANP is a little more clinical. The questions are more clinical, and I have a video about the differences and like tips on how I passed my AANP certification. So it's right here, or you can click like the right link. So you have to get the certification, and you also have to get your license. For nurse practitioners, you're gonna get it from your Board of Registered Nursing depending on your state. In our state, it's the BRN. In California, so I have to get my nurse practitioner license. I have to get a furnishing license. Furnishing license is pretty much a license to prescribe. And then you also have to get your DEA license, and that's the license that you need in order to prescribe controlled substances. So there's a lot of licenses that you have to keep up pretty much. So your RN license, NPF license, your NP license, your DEA license are the main ones that you have to really have to keep in order to practice. Other than that, you can get like specialized ones in certain places. You can be an emergency nurse practitioner. You can get a specialty certification for that. So I hope that answered everyone's questions. If you guys have any more specific ones, please let me know. And I also answer questions on Instagram. It just takes a while for me to answer them, but I hope this kind of gives you guys an idea of what I do and how to become one like me, one of us. So yeah, so I'll see you guys next video. Bye.